paediatric casualty management in the pre-hospital environment. It is very similar to the management of adults, but a few important distinctions. As you can imagine, it's really good not to have to think about too much when it comes to dealing with children, because that can be quite distressing the first time you engage with a paediatric casualty. So how can you offload a lot of that thinking? Well, we can be prepared. We can prepare our kit so that we have specifically packaged and measured out paediatric equipment. We can have paediatric dosing charts so that when we're thinking about the appropriate dose for age or weight of child, that's already figured out the moment we have that information. But far more important than those two very important aspects is adjusting your whole approach to the child. So this is not a small adult, this is a child. So for starters, get down to their level. Make sure that you're on eye line with the child or below so that they don't feel overly intimidated by what is already a really scary situation for them. Engage the parents as early, as friendly and non-confrontationally as you possibly can. They are your best ally in getting this child the best care. So bring them into the resuscitation, the analgesia, whatever intervention you're doing, so that they're as close to kid as possible. If a child imagines that you are the friend, the aid of their parent, they're going to be on your side and know that you're on their side. Now, beyond that, it's really important to speak in friendly, neutral tones, to not be shouting instructions, to try and make a non-threatening environment of this pre-hospital scenario as you can. It's also important to remember that children get cold quicker, that children, to a certain extent, have different airways compared to adults. It's important to remember that children's physiology may be different. Their responses may be later in terms of changing their numbers, and they may be more precipitous in when they do decline. When they do decompensate, you may see a more marked change in far more rapid fashion. Now, all of these things are truisms of paediatric practice, and the child you see may just look really sick. The child you see may look reasonably well. There are certain things that are particular to the paediatric assessment that it's worthwhile carrying in your mind. So how well they're breathing, the work of breathing, the effort that they're putting in is absolutely sensitive and specific for an unwell child, above and beyond the adult. It's also worthwhile noting how well they're engaging. What's their mood? Is this a happy child, an agitated child, an irritable child, a distressed child, or at worst a child who's in no way concerned about what's going on? So the child who's completely ambivalent, detached from what's happening, is likely to be a very unwell child. And finally, thinking about the practicalities and the pragmatic approach to the child that you may have to take compared to the adult version of this casualty. So you may end up having to decide to take mum, dad, Teddy en route in the conveyancing platform. You may have to manage the C-spine and the overall position of the patient in a pragmatic fashion that best suits the best care of that patient.